New research is showing younger generations are at a higher risk of being diagnosed with 17 types of cancer, some of which have been at a decline for older adults.
Yeah, researchers don't know why this is, but here to speak more about this study is our health expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning. What disturbing data, right?
Truly kind of eye-opening too, and really a wake-up call, I think, for a lot of young people right now.
You know, even for the medical community, I would say, because cancer has always been thought of as a disease of aging. We get older, our DNA gets mutations as it divides, and that's how we get cancer. Now we're seeing more and more cancer in younger people. In fact, the rates of cancer in people under 50 have gone up 30%. So if you're born in 1990, you're 2 to 3 times as likely to have some types of cancer than if you were born earlier, like our parents' generation.
Very scary. What's the explanation behind this? Is it diet? Is it environmental?
Yes, and yes.
Okay.
And so the good news is, even though it sounds scary, a lot of the things that might be causing this, or what we think might be causing this, are within our control. So obesity is thought to be the biggest driver. Our rates of obesity are going up. We don't often think of being heavy as a carcinogen, but in fact, it's one of the strongest carcinogens. And the American Cancer Society says 20% of these cancers in young people, even older people, are linked to obesity. So I think that that is a huge driver. What we eat, as you said, Corey, we're eating more processed food than ever before. And there's a lot of emerging data that food actually changes the bacteria in our gut, which can not just change the expression of our genes, but also increase risk of cancer, such as colorectal cancer, gallbladder cancer, pancreatic cancer, all the cancers sort of related to our gut. And linked with that, it's the alcohol that we're using. So we're seeing a sharp increase in cancer and cancer-related deaths in liver cancer in women, especially, because women often try to keep up with the boys. We drink as much as the men do, and our body sizes are a lot smaller. So this is a carcinogen that goes directly into our GI tract, and we're seeing a sharp increase in cancers there as well. So I think some of this is within our control. Now, some of this obviously is environmental pollution and such. We can't control that, but there are a lot of things we can control.
Okay, when you say that, I want to go back to a point you made earlier about, somebody younger has more likely of a risk for, or we're seeing higher risk for that. These are habits we see people of all ages doing. What is the link between younger people developing cancer now?
So we're talking about lifetime exposure to a toxin.
Okay.
So think about when you start and how long you've been exposed to it. So if you started your bad habits in your 40s and 50s, like many of our parents did, for example, they put on weight or they started being sedentary, what have you, you've had less exposure to that carcinogen than our kids and our teenagers who are now starting to have obesity as well early in life, and marijuana use is another, potential carcinogen that they're exposed to. So it's really that duration of exposure that can increase the risk.
Interesting.
Yeah.
Okay, so I think we started out and we said this is a wake-up call for the younger generations, right? Like, what can we do now to change the trajectory of this?
I think you sit down and you look at the types of cancers that are going up and what causes them. And we mentioned a few causes here, but even HPV, human papillomavirus, linked to anal cancer, linked to cervical cancer, linked to other types of cancers. And you see what you're doing that you could do different. And the biggest thing here, the take-home message, is really screening, vaccination, and prevention. Because we don't have to walk down this path. There's nothing different about our bodies than our parents. It's just what they're being exposed to that they're reacting to, causing this accelerated aging. So get in with your doctor and do a comprehensive health history, figure out what things you could change in your lifestyle that could help reduce your risk of these types of cancers.
For a lot of people, it takes a traumatic event to be that wake-up call. I hope we all can, just hear this, and that's enough for us to want to change our lifestyles, maybe just a little bit.
Well, and we've seen so many cases, just our very own Matt Renew, who's diagnosed with thyroid cancer at such a young age. Someone in the newsroom, David Levine, with colorectal cancer. So it's all around us. Certainly I'm seeing it in the clinic, but I'm sure that everyone in the community is seeing it as well.
And based off what you said, people might look at Matt Renew and say, really? He looks so healthy.
The picture of health.
Right, exactly.
Right.
Well, I think that's what you brought up, a really good point. There are things that are kind of out of our control, right? Like Matt is lean and he looks healthy, right? And he was on the younger side, but there are a lot of things that are kind of like no-brainers, right? Like what you eat, get outside, get the exercise. Come on.
Well,
some
and
of it's
with Matt, like we're talking about early detection. So even if there are things out of our control, you're plugged in with medical care, you're plugged in with your screenings, you're getting your mammograms, you're getting your colonoscopies. You could pick it up early.
And that is within your control.
Right. Yes.
All right, Dr. Kohli, some good advice clearly this morning. I hope we all pay attention. Thank you very much. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.